And once again, welcome back to Ask the Doctor. I'm Mike Berger, here to answer your medical questions on pain management today. Dr. Robert Bulger and Dr. Renaud Rodrigue from the Southwest Pain Group. Just call the number that you see on the screen. That's 1-888-572-4411. Or visit the website at www.southwestpainmanagement.com/askthedoctor. Okay, so far we've talked about pain management. We've had a lot of questions, a lot of very good questions. Renaud, I'm kind of curious if there is a case maybe that you did last week or last month that's been very interesting to you, very unique.
I've had a few really great ones recently, some really complex cases. One of the ones that kind of stuck with me last week was a very lovely young lady who came in now about 5 months after a motor vehicle accident. And her original injury was neck pain. She had a really severe collision, was forcibly pushed back in her seat and had more of a hyperextension injury. That got better, but her back was bothering her too. So I found her to be incredibly good historian. She gave me a good description of what was going on with her. And the reason why this is germane to our top conversation today is that this is a classic person who would normally just kind of wallow out there. We're talking about 5 months after an accident. Her internal medicine doctor, well-intentioned though he is kind of sat on it because he didn't know what else to do with her. She's a young lady, she looks good, the x-rays look good, the MRI look good. Figures, well, it'll eventually go away. But we're talking about 5 months now, and meanwhile, she's suspended running, all exercise, in fact, and is starting to get depressed. And I found her to be just the ideal patient for us because there's a lot we can do for this young lady.
How about you, Robert? Any particular case?
Well, a case last week, which is interesting for me because they're ones that we can profoundly help. And these are people with migraine attacks. Typically, a patient with migraine would go to the emergency room or would take some migraine medications, but we're actually treating these people in our office. So this gal came to our office, and we do a kind of last minute. She called last minute, we got her in, we started an IV, and we give them some kind of acute headache breaking medications that can break the migraines in the office.
So many people have migraines. I had a nephew that they were so bad that he would vomit and become very, very sick. A, are there more migraines, and B, are there new medications like you were just talking about that are actually helping?
Well, interestingly enough, the most exciting thing right now for me in pain management is this new migraine therapy. It's called the Reed procedure. It was invented by a doctor here in town, Dr. Reed, and it's revolutionizing migraine therapy.
Fantastic. People call if you have a migraine problem, and the doctors will certainly be able to help you or refer you to someone that can do as much as can possibly be done. Going on with a call now from Fort Worth. What's your question, Art?
I've been on Demerol for chronic pain and need to take a drug test for a new job. Can I be discriminated against for my drug use?
That is a great question.
It is a good question, and it's a delicate issue. But if a patient ethically needs medication for their pain condition, then they have the drug test, then the physician that's prescribing that medication can provide that patient with written support that they need that for medical reasons. So there are medical reasons why people need medication, and we do prescribe and we do support those patients.
Very good. Now, if you'd like to know about other pains, of course, we want to remind you once again to call the phone number on your screen. That's 1-888-572-4411, or go to the website. Something else that I've run into recently, because it happened to a friend of mine, is pain and chronic pain because of cancer or cancer treatment.
Right.
What can we do there?
That's a great area for us because there's just so many things we can do. For instance, we have found that a lot of doctors are so focused, they're oncologists, are so focused on treating the cancer, pain becomes kind of an afterthought. And even though these doctors are skilled at treating pain, they often are more worried about the cancer treatment itself. So we can impact those people with simply giving them better pain meds, not just that, but also blocks and injections that can help with the pain, or even kill nerves that are causing the pain, which is an option that you don't have really for the non-cancer patient population. We can be more aggressive with those people and still be safe to really help alleviate their pain.
A question that I would have, I know we all know people that have had back problems, one reason or another. Are there different parts of the body where pain is much more difficult to manage or to diagnose? Is it a back? Is it a neck?
I don't think there's a particular area that's more difficult. I think the nature of the injury can create difficulty. If it's a nerve injury, that tends to be more difficult to treat than if it's just a tissue injury. So would you not agree?
I agree.
Nerve-related pains are more difficult.
Up to one point, which is some of the patients who have pelvic pain. Pelvic pain is very difficult to treat. We don't see a lot of it. We do have techniques. For me, in my practice, that's been one of the most difficult things to treat. Otherwise, Dr. Bulge is right. Everything else, there are options.
We can always help, but pelvic pain is challenging.
Yeah.
All right, if you would like to ask a question of our doctors today, feel free to call the number on your screen. That's 1-888-572-4411, or go to the website. That's www.southwestpaingroup.com/ask the doctors. We'll be right back.